Hi guys, welcome to our gross anatomy lecture. We are in the abdomen series. Now, so today we're going to talk about the blood supply to your anterolateral abdominal wall as well as venous drainage. Right. So, first of all, you just need to understand the the connection of the blood supply from internal or deep, and then we're going to talk of the superficial. Right. So we are not going to get much into it, but I just want you to understand something here. Right here, this is your aorta. At the teeth cuff, it becomes your abdominal aorta, right? And this abdominal aorta at L4, it bifurcates to form common iliac arteries. And then at the pelvic brim, the common iliac artery it also bifurcate to form internal iliac artery and external iliac artery. So take note of this. We have about four um, lateral branches coming from the abdominal aorta, which are called lumbar arteries, right? You, you can actually see them. They will be lateral branches, right? So we have four lumbar arteries, and these lumbar arteries are going to take part in the blood supply of the lateral portion of your abdomen, right? And then if we get to this external iliac artery, right, the external iliac artery, it goes behind the inguinal ligament and becomes the femoral artery. Before it becomes the femoral artery, it's going to give two deep branches. It's going to give this branch. Let me zoom a little bit. Right. So it may not be present right here or actually labeled, but it's going to give this branch here. That's your inferior epigastric artery. So this inferior epigastric artery will anastomose with the superior epigastric artery, right? So this becomes your superior epigastric artery. So if you remember, you have what's called an internal thoracic artery, and at the level of 6th intercostal space, it bifurcates, forming a musculophrenic artery that will supply the lower intercostal spaces, and then it will sort of like continue as the superior epigastric artery. And it is the superior epigastric artery that will actually anastomose with the inferior epigastric artery right here. So the inferior epigastric artery is a branch of the deep inferior epigastric artery is a branch of an external iliac artery. The external iliac artery also gives this branch, which is the deep circumflex iliac artery. It goes upward and actually supplies the lateral portion of your anterolateral abdominal wall as well. Good. Once you have this knowledge, I think now you're able to understand when we are about to classify the blood supply to the anterior, anterolateral abdominal wall into three regions. Right. So the abdominal blood supply is classified into three regions. These regions are given a special name called the Hager's zones or the Hager's vascular zones. They are very important to take note, especially when you are making an incision, so that you prevent a vascular necrosis right in the abdomen. So let's take a look at another diagram and then we'll come back to this one. Right, so let's take a look here. This schematic diagram actually shows us these three zones. So we are going to have zone number 1, which is right into your anterior abdominal wall. Zone number 2, which is your pubic region. Zone number 3, which is your flank region, just lateral region. So zone number 1 here, zone number 2, zone number 3. Right. So I think now you can actually understand that the blood supply is classified into these three zones. These are called the Hager's zones. So let's start with the zone number one. Zone number one is going to be supplied by blood uh, vessels that are within your rectus sheath. If you remember very well, the rectus sheath has the superior and the inferior epigastric artery. So you have the external iliac artery giving a branch called the inferior epigastric artery, and then you have the internal thoracic artery giving a branch called the superior epigastric artery. And the superior and the inferior epigastric artery will actually anastomose near the area of the umbilicus deep to all the muscles, and they're going to send cutaneous branches, let me say cutaneous blood branch that's going to penetrate or perforate these the rectus abdominis, right, and supply even the skin of this region, right. And then we go to zone number two. If you remember, what did I say? The external iliac artery, it passes behind the inguinal ligament, and it changes name to a femoral artery, right. So it is the femoral artery that's going to give it three superficial arteries. So let me now show you. Right, so this is your femoral artery. It's going to give it three superficial branches. This one is going to be your superficial circumflex iliac artery that will supply the region that is about going towards your anterior iliac superior spine right here. And then you're going to have your superficial external pudendal artery, which will go and supply structures in the perineum. And then you're going to have this important one, which is your superficial epigastric artery, right? That will supply this region. So this region right here, that's your zone number two. So your zone number two is supplied by these branches of the femoral artery: the superficial circumflex iliac artery, the superficial epigastric artery, and then the superficial external pudendal arteries. Good, right? So we are done with zone number three. Zone number two. Zone number three, this is going to be zone number three. This is going to be zone number three, right? So let's take a look at the blood vessels for zone number three. Right, so zone number three is going to be supplied by the following. We have the 10th and the 11th posterior intercostal arteries, the subcostal artery, which is the T12 coming from level of T12, remember? And then we have those four lumbar arteries, lateral branches of the abdominal aorta. And we also have a part of this deep circumflex, the deep circumflex iliac artery coming from the external iliac artery, also supplying the lateral. Right, understood? Good. Right, so that's the blood supply, arterial supply of your anterolateral abdominal wall. So veins are easy because veins, they actually mirror arteries, right? So for example, the inferior epigastric artery will be accompanied with the inferior epigastric vein and so forth. You understand? But I want you to take note. Let me let me look for another diagram. Right, so this diagram is going to assist us on how to know the orientation of the venous drainage of the anterolateral abdominal wall. So at the umbilicus, you have what called para or peri-umbilical veins, para-umbilical veins. These veins are going to be tributaries of your portal vein, right? So they're going to be draining in the portal vein. Take note of this para-umbilical vein. If you remember embryologically, this site, that's where you're going to have your umbilical cord. And inside your umbilical cord, you have your umbilical vein. And the umbilical vein, as it enters the umbilical cord, right, it um, it will be in the free border of the falciform ligament, if you remember. And then later it's going to form the ligamentum teres hepatis or the round ligament of the liver. So these para-umbilical veins, they'll actually be accommodated together with this round ligament of the liver, draining into the portal system. You understand? So in this region, we have three para-umbilical veins draining into the portal vein. And then we also have those superficial epigastric, those superficial arteries we spoke, which were branches of the femoral artery. They're also accompanied by veins, and these veins, they'll be draining into what's called the greater saphenous vein and drain themselves into the femoral vein, right? So what is important is the superficial epigastric vein, because the superficial epigastric vein will actually anastomose, right, with the lateral thoracic vein of the axilla. Remember, this is the axillary vein. It's going to give the lateral thoracic vein, and the lateral thoracic vein will join with the superficial epigastric vein and form what we call a thoracoepigastric vein. Right? Good. Why is this important? Why is this important? Right. So, in cases where you have liver cirrhosis, let's say you're drinking a lot of alcohol, and now the insults or the degeneration of your hepatocytes is now extreme, and you now see your hepatocytes being lined with fibers under fibrosis, right? So that fibrosis will end up blocking your portal veins, leading to uh, portal vein hypertension. So which is the blood will no longer be able to come from the portal vein and go to the inferior vena cava because it has been blocked. So it's gonna look for an alternative route, right? So what happened is this: the blood that will be in the portal vein will be redirected and is gonna pass through or reversed, and it's gonna go through those para-umbilical veins, right? And these para-umbilical veins, they also anastomose with the superficial epigastric vein, right? And the superficial epigastric vein anastomoses the lateral thoracic vein. So you have that blood coming from the para-umbilical vein, it gets into these superficial epigastric veins, right? And then it later drains into this lateral thoracic vein. And from the lateral thoracic vein, it gets to the axillary vein. From the axillary vein, subclavian vein, brachiocephalic vein, we go to the what? To the superior vena cava and back to the heart. So there's going to be distension or dilatation of these veins, which will lead to a condition called Capus medus or medus capus or Capus medus. Let's take a look at the image. Right. So this shows what you call Capus medus. So you can actually see the dilatation of the superficial veins, right? You can actually see this is your thoracoepigastric vein, right? And because blood will be now being reversed, right, and now draining into the lateral thoracic wall, you can actually see the lateral thoracic vein here draining into the what? Into the uh, axillary vein, right? So this condition is Capus medus. Capus medus. You can actually see these dilatations. Capus medus. So the zone 1 region or the skin of the abdomen, it's also a place for portocaval systemic anastomosis. Portocaval systemic anastomosis. What does it mean? It just means that we have some tributaries that will go to the superior vena cava or the inferior vena cava, and some will be going to the portal vein. So we have find out that the para-umbilical vein drains the tributary of the portal vein, while the superficial epigastric vein, which form the epigastric vein, will be tributaries of the superior vena cava later. So this is the site of a portosystemic uh, anastomosis, right? Right, so let's go through a quick summary. We said The anterolateral abdominal wall is divided into three zones: zone number 1, zone number 2, and zone number 3. Zone number 1 is supplied by the superior and the inferior epigastric arteries. Zone number 3, or let's say zone number 2, is going to be supplied by the superficial branches of the femoral artery, which include the superficial circumflex iliac artery, the superficial epigastric artery, and the superficial external pudendal artery. That's zone number 2. And zone number 3, which is this portion and this portion, is going to be supplied by those four lumbar arteries coming from the abdominal aorta, as well as the 10th, 11th, and 12th posterior intercostal arteries, as well as the deep circumflex iliac artery, will supply the zone number 3. So thank you so much, guys, for listening and paying attention. See you in our next lecture video. Take care.